Namaste and good morning. It's a pleasure to be with all of you today. Over the last 18 to 24 months, my father, the chairman of Apollo Hospitals, Dr. Pratap C. Reddy, has commented on so many occasions that the world has never seen a situation like this pandemic. He has also commented that this is an opportunity for us to rise above these adversities, to learn, to show resilience within our organization, and finally, to be resolute about the fact that we must enable universal health access to everybody. And that is truly what all of you are talking about today. And thank you for this opportunity to share a few thoughts. In fact, on September 5th, I tweeted that the Teacher of the Year award goes to COVID because it taught us so much. It taught us simplicity, it taught us adaptability, and it definitely taught us resilience. It taught us teamwork, support to the community, and it truly changed so much of our paradigms on what is important in life. Let us take those life lessons. Let this teacher, a teacher that we don't want to see again or anymore, be a lesson that we've learned, but let us move on. And in that thought, let us truly spend the time, money, effort which is required to create that aspect of universal healthcare for all. I'm particularly privileged to congratulate the teachers of your incredible institution for the tremendous work that they have done over the years, and to congratulate the IIT Mumbai. You are a global leader, not just renowned for your skill and prowess in engineering, but also in thought leadership, in research, and in bringing out professionals who go to become world leaders who are helping humanity at large. So congratulations, it is indeed my privilege to be amongst you today. Talking about something that I feel so strongly about, which is truly the paradigm shift and the outlook in healthcare. I think the first and the most important one is that we must stop saying that we are a generation where so many people die every few minutes, where there's a shortage of beds and a shortage of doctors. We must stop looking at those negativities. And first, the paradigm that we look at is universal access to healthcare. The paradigm we look at is great infrastructure and a transformational ability for everybody to have access to good healthcare. That is where we are very, very clear that we must enable this world of universal access. And how are we going to do that? What are these levers of change which are going to enable us? I think the first set of levers have really happened in the ecosystem or the environment around us. The first one I want to talk about really is the metamorphosis of our patients, who are no longer patients, but actually smart consumers. They are very aware, they have data, they have knowledge, they want to actively participate in the care. They're looking a lot at self-care and preventive care, and they're looking for on-demand service. We used to say earlier in the healthcare field that the patient needs to learn how to be patient. But today, you're talking about immediate access to a doctor, waiting times under 15 minutes, and in fact, these are some of the service deliveries that we at Apollo also are giving. But we're also talking about storage of data, of personalized care, of an understanding and an appreciation of genomics, and an ability for this patient to say that I want to understand myself, but I also want to connect with communities online as well as in the physical world, and become more knowledgeable and aware of what I can do. I think the next important lever of change is really digital health. This is disrupting the healthcare landscape. 20 years ago, actually 21 years ago, when Bill Clinton visited India, he pressed a button which connected a small village called Aragonda with our high-tech hospitals in Hyderabad and in Chennai. And this was viewed literally by the world. And what he saw, what he viewed, was a doctor doing an echocardiogram on a young child, which was relayed to the high-tech hospital in the city. And the cardiologist interpreted that echo and diagnosed a hole in the heart for that young child, and went on to say that let her come for surgery, we will be able to repair this, and she will go on to lead a normal life. 22 years later, This young girl is not only married but has children of her own. She has led a normal life. She graduated from school, went on to become an engineer herself. And I think that was the beginning of a journey of ours to say that while doctors may not be available in villages, the capability, the care, the diagnosis must be. And that was the beginning of the digital revolution. Today, I think from anywhere in the country, we can access that care, we can order medicines. Now we can monitor our ICUs, our eICU is connected to say that a patient who is in a small remote village is being monitored by the critical care specialist 24/7. So this shift to mHealth or mobile health by the customer. And then the exciting aspects of what artificial intelligence can do when it is embedded in the care, because the body of knowledge in healthcare doubles itself every 9 days. And in this pace of change and acceleration and research, how do we enable the doctor to know what's the latest and the best? It is only by using technology and by embedding this learning, information, and AI into methodologies of care. In fact, in healthcare, I call AI not artificial intelligence, but assisted intelligence to enable the doctor to take the right decision. The next fantastic aspect of digital health is really IoT, wearables, implantables, digestibles. The whole aspect is changing the way we look inside a patient and monitor a patient without being too invasive. And surgery itself is getting minimally invasive. You can do an open heart surgery. I was in Bangalore 2 days ago, and we celebrated one of our doctors who had completed 100 robotic heart surgeries and 1,800, and this is a world record, 1,800 minimally invasive cardiac surgery. That means without cutting open the chest, making just 3 keyholes, putting in the camera and the surgical instruments through the trocar, and then operating on the robot. So these are amazing modifications which are happening, but this is just the cusp of many, many new things coming. 3D printing technology, we're now doing that in our hospital in Hyderabad, but soon there will be 3D printing of tissue. You juxtaposition this with the digitalization of medical research and follow this on with wearables, with augmented and virtual reality, so that medical students are now going to learn using AR and VR techniques. I think also being a healthcare provider myself, we come from Apollo Hospitals, our first hospital set up in 1983, today over 10,000 beds, and what we really do is high-end care. But the new avatar of healthcare providers, we're looking at more specialized care, we're looking at subspecialization, we're looking at partnership and outsourcing, we're looking at an increased number of insured patients, and so very soon we will not be just billing or open billing. Of course, we've done package deals for a long time, but I think the important aspect is that we will find a way to look at the entire life care of a patient, not just the sick care of the patient. And I'll talk to you more about how we're thinking of doing that. But also there's the aspect of on-demand care, there's home care, there's partnership with nursing homes, so there's subacute care. The methodologies are changing, and then the other lever is really all the innovative diagnostics and treatment. In Chennai, we have one of the most amazing pieces of technology called the proton. The proton beam therapy ensures precision in the irradiation of the tumor and saves all the peripheral tissue. This is the first machine in Asia, and it is things like this which are enabling precision medicine, but they don't work alone. They work in a framework of understanding the genotype of the patient, of analyzing the tumor itself, of working with precision medicine and bringing together the best outcomes, and all this is documented in the electronic health record. And then we understand whether gene therapy is going to be a good aspect for this patient, or we continue on this modus of care. So standard treatment pathways are getting individualized to enable precision medicine, and therefore the best and the most accurate and the best outcomes for a patient are being created using these technologies and these levers of change. Another super important aspect that we must discuss in levers of change in the new paradigm is the new paradigm of healthcare workers. The healthcare workers are no longer the senior doctor who doesn't talk to you. Our doctors are young, cool, digitally savvy, and can telemedicine and network with you. They understand your pains and your problems, and they're ready to discuss them. Our nurses are more empowered, more educated, digitally savvy, and definitely multi-skilled. The new age technicians, whether they're respiratory technicians or multiple others, appreciate their job, are capable, and are playing a very critical role. I needed to bring out this important aspect because very few people understand that healthcare is among the largest employers in the world, that healthcare individuals need to be extremely well qualified and trained. They have to combine the high tech with the high touch, with empathy and emotional quotient, and also that there is a global shortage of approximately 17 million healthcare workers. And I visualize that the youth of India can step up, be trained, and take their place. I visualize a young India taking care of a graying world. Another important, key lever in change is the growing regulatory and governance framework which is required. So the government, I think, has already brought out a Personal Data Protection Act. The understanding, appreciation, and implementation of this act is important. The simplification of a large number of the regulatory compliances is something that we are looking for as healthcare providers. Currently, we have 3,624 regulations to comply with. Way too much work. We should be spending our time with patients. It's also important, I believe, the government, we don't have it right now, but between insurance and the government, or even at a private provider perspective, we could create a framework for reporting health outcomes, because what you measure, you improve. If there's a common, credible platform to talk about results post-CABG, then everybody aspires to do more, and not just the few providers who maybe have a joint commission accreditation, and therefore that's a regulatory requirement for us as part of JCI. But moving on, the other, I think, very important aspect that we can look at is a national healthcare benchmarking platform. So if we take best practices or benchmarks from across, what is the door to needle time when a patient comes into emergency? If he's having an acute MI, what is the door to balloon time before you did a primary angioplasty? If we set benchmarks like this, if we display them on a credible platform, then a patient is able to become a more informed and empowered consumer. So some frameworks like these are part of the changing paradigm of healthcare. I think that the future of healthcare is exciting. It's a combination of so much in terms of an empowered consumer, a changing ecosystem, the capability of digital, IoT, mobile health, the teledensity of the mobile penetration, all these, as well as science, technology, new methodologies coming in, the genotype, phenotype, artificial intelligence, robotics, so much happening. And finally, I think it's so important that we look at healthcare as an integrated ecosystem where the GP, the immediate hospital or nursing home, the tertiary care hospital, home care, the diagnostic all work together, and the patient or the patient family is no longer left to go one by one and discover healthcare, but a group of empowered and connected healthcare providers encircle the patient with this positive, proactive healthcare. Let me end by talking about my final and my most important paradigm in healthcare, and that is really how we will shift gears to understand the smart consumer, to really engage with this consumer more, to let them share and understand what are the capabilities and why do we want to do this. It's very, very simple. And this is something that equally we have dedicated a significant portion of our time and our effort at Apollo. And this is about proactive preventive healthcare. Do you know that 62% of all cancer patients diagnosed in our country come in stage 2 and stage 3? How do we create national health check and screening programs so that we find problems early? This is really the biggest paradigm that we have to create in healthcare, is that we do proactive preventive healthcare and not reactive, episodic, symptom and pain-based sick care. This is the paradigm we're looking for. We've designed a product called Pro Health. It has an AI engine at the back of it. It has an engagement platform. It works with digital therapeutics. And I hope this will be one of the foundational steps towards transforming healthcare. But finally, I think the best aspect of healthcare is an appreciation that health is about a circle of life. It's about healthy living. It's about clean drinking water and nutrition. It's about ensuring that every baby and pregnant mother has the right kind of care so that they come into the world healthy. And this is what we've done in our village in Aragonda. We have among the lowest infant and maternal mortality rates in the country. Because of this, we've worked on the social determinants of health, which is clean drinking water, nutrition, pollution, and now in an urban environment, sleep is equally important, stress and removal of stress. We've incorporated yoga into the program. We have a hospital, we have telemedicine, but most importantly, we have community involvement and a WHO-based screening of the entire population. So 72,000 people are screened, have a health record, and we do positive interventions to ensure that this population stays healthy. And you know what? Last year, we found only 2 patients with cancer, and both of them we detected in stage 1. So the dream is really a healthier population, and that is the biggest paradigm shift in healthcare, in addition to universal access to care, proactive care, and the society and the community being a part of care. Thank you all very much for this opportunity. I wish you the very, very best in your careers, and I hope many of you are inspired to help us in this journey towards a healthier world. Thank you very much, and namaste.